record as well. So all sessions we record, and you get a copy of the recording of these sessions from the Moodle. So there'll be a link which will be available after the session, and that link should allow you to revisit, the recording, so that if you need to go through or revisit anything, that would be easily available.
Okay, that will be good.
Okay, so let's start off. Now, a couple of things that we want to look at specifically in the case of, this particular unit. So you're doing the level 6 diploma in occupational health and safety, and there are overall, I think, 6 units that we'll be looking at covering. We are starting off with the first unit, which is, health and safety management practice, which is the first unit. And this unit will essentially help us lay down a bit of foundation in terms of what all is actually covered in the remit or the field or field of occupational health and safety when I say this. So, as somebody who is going to be working in this area, what we want to be able to understand is what are the key principles of health and safety, how a health and safety policy is formed within the organization, what could be the changes which could affect that policy from inside the organization, from outside the organization, and sometimes even legislative and regulatory changes which typically tend to happen when standards change, or when government or regulatory authorities actually introduce changes, to keep things up to date with regards to health and safety of employees working in a workplace. And we'll also be looking at obviously developing some understanding and idea about what are the health and safety management practices. So this unit would focus on, helping us develop a bit of a foundation. If we were looking at, say, for example, if you were working and you're looking at starting a business and you're a startup company, how would you initially set some of the policies, practices within the organization, which will essentially be focused on giving you a bit of a foundation, or let's say a starting point to implement the health and safety compliance related, I would say policies, regulations within your organization.
Okay,
So this unit, we are looking at covering, this unit has 5 learning outcomes or 6 learning outcomes essentially, if you see. Um, and what we are going to do is each session we are going to cover one learning outcome and its associated assessment criteria. And the associated assessment criteria, when we discuss, we are looking at covering this indicative content which has been provided, by the awarding organization. So for this particular unit, we are looking at about 7 sessions. Because the 7th session after the completion of the 6th learning outcome would be looking at the assignment discussion, wherein the assignment discussion looks at, asking you to then submit a report, and that report will cover learning outcome 1 to 4, which is going to be approximately 2,000 words, learning outcome 5, which is an essay, and a learning outcome 6, which is again an essay. But so the total assignment, in terms of evidence that you create, is going to be about 4,500 words. And in each of these sessions, the idea would be, and the presentations that you look at, and the books which are uploaded, handouts, and some reading material that I would provide, would essentially be elaborating on, whatever we are discussing in the learning outcomes and the assessment criteria. Plus, they will substitute or give you additional knowledge and information on, the indicative content which is required to be covered to say confidently. So I've read this, and when you have read this, you would feel confident that I've gone through enough material to be able to understand the concepts given, the theoretical frameworks given, and even examples to discuss, how some of the practices can be developed within the organization related to health and safety. So today the starting point would be to look at, going through the first learning outcome. And what I'm also going to do is just briefly trying to quickly log into, the system. So I'm going to try and show, although you have access to it, I know, but the idea here is to try and show the resources that you would also be accessing. And these would essentially be useful for you, to basically revise or go through some of the bits, after the sessions have been essentially conducted. So Give me 1 second and let me show you that as well, so that you have a very good idea in terms of what all is involved as far as the study of the course is concerned. So I've opened up Moodle. So this particular course should be accessible to you through the Moodle. Today we are going to be looking at starting the first unit. So just to give it a bit of a highlight, this normally now at your end you would see this in a yellow colored box, which would mean that this particular unit is the unit that we are starting off with. And sorry, the second unit, which is the first one, which is health and safety practice, that's the one we are starting. So I'll move this up
I think the
here.
first one I already started, I think, with the policy.
Policy one, okay. That one I will come to after this unit, or one of my colleagues will come to after this unit, because what we want to do is help you understand, because you are outside the UK. So in the UK, most of the content of this particular qualification typically tends to follow what is the Health and Safety Act, or HASWA, HASWA, which is the Health and Safety Act of 1974. It was obviously refreshed in 2008. And there is a website that we look at following, which is the
Yeah,
Health and Safety Executive website.
yeah,
So some of the course material, some of the information that you would see on the slides, and also some additional related information that we would provide you to go through would actually come from this website. Now, obviously, lots of countries have different standards which they have developed, but they tend to follow some of the practices which have been created by, the HSC as a governmental body in the UK, and
mhm,
part of it is, seen as interpretations and implementations in other countries. Now, there is also a very good website which is primarily the British Safety Council. This is again, a website which primarily, relates to keeping things up to date with regards to occupational health and safety. So there'll be some references of it, in our discussions that we will also have, in the presentations. And obviously, when I show you the presentation, there'll be some links that we will provide to these websites and other articles and relevant case studies which would be associated with each of the learning outcome that you are studying. And they would give you an example, practical application, an example of how this is implemented, or how this relates to this policy, or how this relates to the regulation. And if I was the health and safety manager for an organization, how would I go about essentially, implementing some of these standards and policies within the organization.
yeah.
So
So this is related to what again?
this is these websites will be useful for you to get some idea in terms of reading up-to-date
Mm.
information which is implemented, specifically related to standards
Mm.
within health and safety.
So
So,
you mentioned the agency executive, and what is the second one?
and the
British.
British Safety Council, British Safety Council.
Okay.
So I will share the links with you. They are already in the presentation, and I'll show you so that you have them available, at your end. I'll show that to you in a presentation in a minute.
Mm.
Now, in terms of the organization of the units, what you generally have, the unit specification on the top, which is what we will refer to every time, we start the session, because that is what gives us a bit of a guidance to say this is what is required to be covered. That's the document that I've opened up earlier, which is on Moodle. And then after that, you have some books, assignment briefs, and then the presentations. If I update the presentations, what will happen is you would see LO1, which is the learning outcome one presentation, but it will also add a hyphen new next to it, which would mean that the presentation has been updated. And the idea is when you study and when you go through these, the importance that you will give, or precedence you will give, would be to presentations which are new or updated presentations rather than going through the old material. And this kind of a thing would follow through pretty much, in all the units. Now, when how would the recordings come in? So under the learning outcome one, after the session is over, you would see a recording link which will appear here under each of this. So when you click on this, it will take you to our YouTube channel, because obviously YouTube is a free repository. So what we tend to do is any sessions that we are doing, We put a link here, and the uploading of the video, which is 1 GB or so, would actually be done on that side. But it'll go through from the Moodle for you to have everything in one place. Is that okay? So now switching you over to the presentation, because that is what we will use to do the discussion on, what we are going to cover in today's session. And this unit, which is health and safety management practice, we are going to be looking at covering learning outcome one. Now, learning outcome one is focused on the process of planning and organization of how you would implement a health and safety policy or practices within an organization. So if I look at a couple of things. Yeah, go on.
So my question is, for each one of the upcoming sessions, could you maybe in advance give me like a heads up which files I would need to be reading so that maybe I'll be prepared. Because like the last time I've spent some time reading the policy unit. I thought where we were going to talk about,
All right, okay, that's fine.
but it's
So,
okay, no worries.
yeah, that's
But
absolutely
just
fine.
do you advise me to do so or what's the approach?
That's perfectly okay. Yeah. So what we are going to do is, because we started this unit, so even in the next session that we are going to do, next session will cover learning outcome two. So if you want to go through, then you would probably go through this unit first, and then it will be primarily the learning outcome two that you will go through when I think we have the session on Tuesday, isn't it? The next one. Tuesdays and Saturdays. So the next session will cover learning outcome two. The next Saturday session will cover learning outcome three, and so on and so forth till we complete this particular unit. Now, one of the reasons of also moving some of the units around is to look at which units have lot of content. So this unit is quite a big unit because it has 6 learning outcomes. And you would see some of the other units, have two, or most of the units should have, 4 learning outcomes. But some units also have three, and generally, as a practice, most awarding bodies will have 4 learning outcomes. So what we try and do, in short, what I'm trying to say is sometimes we start you off with units which are quite long, and sometimes we start you off with units which are very simple units to follow, simply because we feel that these units can be completed quite quickly, and there would be units which will require additional time, and obviously, from a point of view of larger coverage. So that could be one of the reasons why we also shift the units around. But there is no specific chronology which is recommended, for study of these units, because they're all going to have health and safety part of it within it. But sometimes what you would see is that some of the units would primarily be focused on policy, some of them will be practical, which will focus on implementation, and so one or two of them are specifically focused on, you having a good knowledge of how you would become a health and safety practitioner. So that unit, practitioner unit, we've kept it towards the end because most of the work involved in that unit will be practical. That means you will need to produce evidence, and actual evidence would be required to be produced, and they would essentially allow you to start putting into place or putting the use of what you have studied so far in the previous units into practice. So for now, some of the units that you're going to study are going to be theoretical, but maybe the latter part of the units are going to be practical, because there it will require you to put into practice what you've learned in unit 1, 2, 3, or 4, and then you're actually practically doing the assignments for those units, wherein you're acting as if you are a practitioner of health and safety. Now, let's start with the first learning outcome. Now, in this learning outcome, we are looking at covering this indicative content. So it talks about things like governance, in terms of what is the governance related to health and safety sector. How do you, as a consultant or as an individual, if you work within this role of health and safety manager, how do you look at planning and ensuring that the implementation of any sort of policies, practices, compliances are implemented within the organization? We would look at understanding the PDCA check, which is a PDCA cycle or a process that normally most health and safety practitioners follow, wherein you look at planning of some of the standards first, then you check those standards against certain benchmarks or market requirements, government requirements, and then you put them into implementation within your organization depending on what are the gap areas, and when you have done an audit, a health and safety audit within the organization to see what are the gap areas, and with that audit in mind, you would then essentially put the implementation plan into place. Now, the other bits that we're going to focus on is looking at what could be the communication systems health and safety manager or a person working in the OHS, in short, as we say, occupational health and safety, would need to have in place. And if it's a larger organization or a setup, then what are the systems typically in place, to make sure that compliance point of view, regulatory point of view, and what are the things which employees are supposed to follow, and what are the things which the employer is supposed to provide, and how do we ensure safety of collectively employer and employee, ensuring the safety of employees working within the workplace would be ensured by following these systems, and how do you communicate them to the relevant people within the organization. And then one of the key aspects that you're going to be looking at is, because as a health and safety manager, one of the key aspects that you do and would maintain would be audit process across the year. So this is a department, or this is a role which typically requires you to carry out audits across the year, depending on the say for example a situation or a workplace or a workplace or a branch office, and if it requires you to regularly carry out monitoring of the say for example equipment, then how you would go about doing it, and what could be the audit process that you follow, which allows you to mitigate any sort of risks which typically can be faced by people working within that department or within that location. And then some part of it is also related to human resources, because people within the HR department, and when you work within this particular role, you would also be liaising very closely with people within HR, because some roles, for example, if people work within chemical refinery or petroleum refinery or in locations in construction sites, then it is important for any worker or any person to be able to start working in this site, that they have to be cleared off with, or signed off essentially with, some sort of training, a checklist. And in such cases, there is coordination with regards to the kind of people being hired, and obviously do they have relevant skills and training and qualification to be able to work within that location. That would require a bit of working together with the HR. So there are bits and pieces related to assessing the resource and skills required when you plan a health and safety, for a particular workplace. And that could be a bit of, a theoretical part that we look at, towards the end. Now, if I were to start off with one or two basic questions in terms of learning outcome one in this particular unit, one of the first questions which comes to the mind is, because this is a word or a term that we are going to be using quite often. So it is best that we understand this term and the meaning of this term, and have a good working knowledge and understanding of why this is going to be used time and again, and what does it actually stand for. So when you talk about occupational health and safety, which is OHS in short form, this is basically a field or a discipline which normally deals with safety. I would say starting with HASVA. So it basically deals with health, safety requirements, and well-being requirements of people working within a workplace. So if I am an employee of an organization and I work within a particular location, whether it's a construction company, engineering company, services organization, a call center, you work within a grocery store or a retail outlet, whatever it is, or in a standard office wherein it's an administrative or a operational role, you would be required to conform to certain rules and regulations while working within the premises. And the employer would also be required to conform to certain government oblique legislative requirements, which would mean that they would need to have certain basic minimum standards to be able to allow employees to come in, or staff to come in, or contractors to come in to work into that location. Now, these set of practices which basically allow the place to become a secure place, wherein, for example, it is not, having damp. It might not have certain material which is being used in the construction of the site. In the UK specifically, you have things like asbestos and some of the others which can lead to some sort of illnesses, cannot be used in the construction of the workplaces. And it could also mean that there are the premises, physically is also secure from a point of view of people working within that location. So when you do look at these kind of practices, policies, procedures which are followed through by the employer and the employee or staff within that organization to ensure health and safety and well-being of people working in that place, would all be a coverage under something called occupational health and safety. So the field of OHS, if I put it this way, occupational health and safety essentially, covers uh, the health, well-being, and safety of an individual working within a particular, organization. So this concise definition has been taken from the British Safety Council. So if you have to read about definitions of, what is OHS and how it is defined, there could be slightly different variations of it. But from a point of view of a succinct and a concise definition, what does it mean and what does it cover? Essentially, this would be the, I would say, a summary or a concise definition of what is occupational health and safety. So, if somebody is to ask you, and I know that you work within this field, you would be, from a point of view of defining what is OHS, would be essentially saying that it's a practice that deals with safety, health, welfare, and well-being of people when they are at work, and providing a safe environment for staff is a legal responsibility for companies, specifically in the UK or in United Kingdom. And obviously, if I look at Australia, some of the other countries like US or other places in the world, there are certain sites of standards which companies need to conform to, and these standards would all typically fall under what is called the occupational health and safety. Now,
Mhm.
when I say it's a legal responsibility for companies, it also means that, both the prevention and treatment of any sort of illness, if it happens because of the shortcomings at the workplace, will all be covered under the employer's responsibility. And for example, one of the things that you would have noticed a couple of years back now is that during COVID, the governments across the world had to introduce lockdowns or the 2 meter distancing rule. And this was done primarily to ensure that staff, if somebody is carrying the symptoms, is not contracting, or these symptoms are not being passed on to other employees who would contract them, being at the same workplace, and if there was no sufficient distances being maintained. So this would be a major thing which was covered under COVID, because it was all related to occupational health and safety. When we were at home, it's our own responsibility. But things like isolation, 2 meter distancing rule, covering your face, eyes, ears, and face, and wearing a mask was made a compliance during that period, because it was just required as per regulation by the government to stop the contraction of this disease, or the let's say the
Excuse me.
propagation of this disease.
Excuse me. Like for the last 30 seconds, I couldn't hear. Could you please repeat?
All right, okay. So I gave an example of COVID. COVID as a recent example which we have seen in the last few years was directly related to occupational health and safety. And this was primarily due to the fact that the 2 meter distancing rule, wearing of the mask, was required to be done as a compliance. And that was something which was introduced by government as a regulation across the world by various governments. And the regulation was that implemented in the form of either wearing a mask or maintaining a 2 meter distancing, social distancing in a workplace. In some cases, in extreme cases, it also meant that lockdowns had to be introduced in order to ensure that the disease does not spread, COVID-19 does not spread. Is that okay?
Yeah.
Yeah,
I have just a question as well.
yeah, go
What
ahead.
is the difference between health?
Yeah, difference between health and Sorry, you've become frozen. Yeah, difference between health and
Hello, and safety.
yeah, go on.
Yeah, what is the difference between health and safety?
All right. So when you look at very good question. So when you look at health, health refers to general well-being of the individual in terms of, for example, when you come to workplace and you're coming to work, you're not showing any symptoms of any ill health, and you're generally quite well in good medical condition. Or I would say fitness. You sometimes what happens is when you join an organization can ask you to provide a fitness certificate. That means you've ensured that you've declared you have any illnesses. For example, sometimes people have type 2 diabetes, or if they have heart condition or any sort of illness, then that needs to be declared on the application form. So when we talk about health, health refers in general to well-being of the individual. That means the person is medically fit. And it also means that the person has a positive sense of mental, physical, and social well-being. That means in some cases employers would ask you to provide medical background is because if you have any sort of disability or any sort of additional requirements, then in such cases, the employer can make those provisions for the employee. Now, when we talk about safety, safety is a feeling or a general feeling of security which the person or the employee or a staff or a contractor should be able to get within the organization they are going to work, or within a place where they are going to work. That means they should be able to discharge their duty without any fear or any danger or any sort of injury that they could sustain while working within the organization. So when we talk about the definition or the difference between health and safety, safety is general well-being of the individual, physical, emotional, and social, and safety being that the place is safe for the individual to be able to work. And sometimes you see that when you work in workplaces, female employees can say, I feel intimidated. Now, that should not be the case. So, safety refers to that the employee or the person should be, or a contractor, or any visitor or guest coming to a place should be able to actually discharge their duties without having any fear of danger or any sort of injury.
Mhm. And like with the references you provided, I was reading, and I don't know if I got it right or not, but they kind of mentioned that safety is more than a short-term thing, and health is like a long-term thing, or not really.
Yes, there is. You can already obviously do a bit of expansion in terms of when I add the word occupational health and safety. But when we do add safety, tends to be that it is a requirement at the employer's end to ensure that the premises, the equipment, for example, they provide, or anything that the employer is providing for the use of employee, they need to maintain safety from a long-term perspective. Simply
Mhm.
because if you look at organizations, every year in the UK, most organizations would need to get PAT testing done, which is primarily, testing of, the electricals
Port Portable
working.
appliance.
Yeah, correct. So safety tends to be long term, because you can't say that you build a house, or you build a let's say personally, if you build a house, or commercially, if you look at, you have an office premises. Now if the office premises is new, it's covered by a 10-year warranty, that is fine. But even after, once the 10 years are over, you would need to start to look at compliances and ensure that the safety of the building is there. So safety tends to be long term, because you'll have to do regular audits. Is the because there is normal wear and tear and things like that which are happening within the premises, and that would require a simple example of that would be, if you have a premises and within that you have lifts. So lifts would need to be serviced every year in order to ensure that they're functioning properly. If you have an escalator or any sort of equipment which is used by employees, which is for general use of employees, that would involve ongoing procedure or standards and checks, and that is why safety as a process is going to be ongoing. Similarly, when you look at health and well-being, that could also be ongoing. So you're joined as an employee, you're perfectly fit and healthy, but maybe a year down the line, 2 years down the line, if you develop any medical conditions or conditions which are outside the purview of the employer, you're required to report them to the employer that, okay, I've had this, or I've had this surgery, or things like that. And the employer then tends to work with the employee to ensure that adequate changes are done into either the premises or in the surroundings so that you are able to work comfortably.
Mhm.
So the concept can be the reason why. And I started when I started the unit, what we said is that this is an ongoing process. It is not a process that you do it once and then it is done. It is an ongoing process. You have yearly audits in larger organizations, you have quarterly audits. In some organizations, you have monthly audits. So, in a place that we are located in Manchester, we are in a big office facility and we have fire drills every month. This is one of the things that the landlord has to ensure that health and safety of the tenants, which is basically offices, are maintained, and that is why they do a fire drill, every month, and that is a drill done to ensure safety and well-being of people working within those buildings. Now, if we go into an overarching view of what is health and safety, and specifically occupational health, with when different, differentiating the two words, as you've done, say for example, what is health and what is safety. So there are two videos that I've recommended that I would suggest that you watch. They're short videos of 2 or 3 minutes, and I put the link of the videos here. This particular video, would highlight the critical aspects of what is involved in health and safety, specifically related to health and well-being of an employee when they work within the organization. And the information this video provides is primarily related to how an organization then develops the different types of practices required to ensure uh, a well-being and health of the employee while working within the organization, and what could be the potential hazards which could be faced. And obviously in such videos what you're going to see is that there is generally details of this taken from an engineering, construction, warehouse, or an organization which involves different kinds of working. For example, workers working on the factory floor, you have people working within the administrative side of things, people working within the office, and this would give you a general overview of what is the meaning of occupational health and what is the meaning of what is related to occupational safety. Is that okay? So, due to copyright, sometimes we choose videos that are essentially going to be included in presentations, but we give you the links to watch because of the fact that under, Licensing Act, these videos are private videos, but they are related to the content, so we don't end up playing it. But you can actually look at them on YouTube, and if I share with you, the links are there, and these are the two videos that I've shortlisted that I would suggest that you watch. So one is occupational health, and the other one occupational health and safety. And these videos about 1 or 2 minutes each would essentially give you a gist or a synopsis of what is meant by occupational health and what is meant by occupational safety.
Okay, sure, makes sense, Yeah. One another thing, could you please also explain to me what is well-being? What is meant by well-being? Because I see it's a lot. But
Yes. So nowadays, when you look at, well-being is a big term or a very generic term. What I want to do is basically look at defining well-being from a point of view of what is well-being at work. What is the definition of well-being at work? Now, if you see the UK in particular, there are 2 or 3 aspects of how the government provides medical services through the National Health Service. So there is health, there is obviously well-being, and there is mental health well-being. So when we look at talking about the meaning of well-being in a workplace, that refers to essentially an employee, being able to work within a location or a premises, or say in a pretext, in general, being able to work wherein they can feel that they are going to be mentally, emotionally, and physically having an environment which essentially provides them the comforts to be able to work within the organization. So when we do talk about well-being in general, and the word or the term which comes across as employee well-being, is essentially how an employee feels about the various aspects of the working environment. And that could be physical aspects of it, it could be resources aspects of it, it could be relationship or aspects of working with other individuals. Do they feel intimidated? Do they feel fear? Do they feel comfortable while working with other employees or other members of staff within the organization? And does their job actually, or the employer's responsibilities, does that job actually entail that they have a balance between work and life, personal work and life, while working for an organization? So, employee well being essentially would be defined as, or well being essentially would be defined as how an employee feels about the various aspects of their life, whether it's their personal life, whether it's their work life or professional life, and what kind of relationship it is allowing them to form when they work within the organization, and the factors that can affect these aspects of well-being, which is personal, professional, and working relationship, would be all covered under what is called well-being.
So well-being is a kind of a feeling, right?
Yes. So when we look at occupational health and safety would define three areas: health, safety, and well-being. So well-being is the mental aspect of it, safety is the physical aspect of it, and when we do talk about health, again related to physical as well as the medical aspect of an employee or a contractor or a worker within the organization.
Okay.
Is that okay? Now, there are various ways in which employers look at maintaining well-being. For example, you would see that just to put this in context, sometimes you would see employers would encourage their staff to take regular breaks. Now, there are lots of people which work within services organizations. So if you imagine a person working within a call center kind of a setup, what would generally happen in that case is, because they're in front of the PC all the time and they are talking and using the phone, what generally employees would do in terms of promoting well-being for the individual, their mental well-being, and for health reasons, what they would say is ask them to take regular breaks. And these could be 5-minute breaks every hour, or 15 minutes break every 2 hours, in order for them to not feel claustrophobic, or for example get outside and get a bit of fresh air because they are always in front of the PC. Similarly, within factory workers, sometimes you would see that they work in shifts, but essentially they would also have regular breaks that are allowed by the employer, because they would want them to have well-being. That means a balance in terms of enjoying outside fresh air along with working within the premises. And well-being could be in various different aspects. It could be mental health well-being, which is related to maintaining good relationships with their employees and their peers, which they work with within the organization. Being physically active. So the example of a call center and the breaks that I've given is well-being, wherein the employer is encouraging them to take a break, and that taking a break is essentially to make them physically active, because they're always sitting in the organization. For workers working within the factory, they said would be primarily related to relationships, because they would want them to interact and obviously go outside and spend a bit of time when they are doing the same repetitive tasks during the shift that they work in. So it could have different definitions depending on the setup and the organization that the people are working within, and employers would put these practices in place to ensure that they are keeping fit, both physically and mentally, and they are also safe, or get that impression and the feeling of being safe when they work within their environment. I would, in an office kind of an environment, if I feel that the work that I'm doing can also be given to another employee, then this can make me feel stressful, because then I feel that I can be replaced within the organization. If I'm off, then my work would be given to somebody else. And that would also start giving me a bit of mental stress, to say that means, my job description is there, but it is not fixed to me, and somebody else can pick up that job. But yes, if you go on a holiday or you book a holiday, then as a part of a team, when you're working, you would do a structured handover. And when you come back, you get a structured takeover and you resume your job. So in such cases, that would be constituting well-being, and that will also be constituting well-being from a point of view of emotional well-being, because you don't feel threatened that my employer could take my job away and give it to somebody else. So there could be various types of examples on this.
Yeah, I understood your case, but what was the beginning of the example? What was the case? I understood it, everything you said, but just the beginning.
So the beginning
What
of the
was the?
example was to say that depending on the organization and the setup that you work within, sometimes within the office, employees would feel that, I've been given this responsibility and I start and I manage this to the end. But if the employee feels that, if I'm not working properly, or in some cases, the employer can replace me, then this can give you a bit of stress, because they then feel that my job is not mine, or my job is also shared with others. And in such cases, if it's not explained and it continues persistently, then the employee can feel stressed. And that would be related to well being,
Yeah,
because they will feel that I'm being replaced within the organization, or I can be easily replaced. So, when you look at job security and you relate it to this aspect, that is where the person can go to the HR and say, okay, I'm feeling a bit stressed or a bit unsecure, because I do feel that the job or responsibilities which have been given to me is also being given to somebody else, and that creates a bit of a conflict of interest, and that is giving me stress. So well-being is a new area which has been added in developed countries, specifically when we look at people working within jobs, and this is related to stress and mental well-being, or mental health. And stress essentially comes across because people generally feel stressed, because they feel that what I'm doing is also being done by somebody else, and the organization has built up a bit of a backup or a shadow, and that makes them feel intimidated, and sometimes they can feel stressful. Now, let's look at some of the assessment criteria with this background, in terms of what it is asking us to cover in this particular task, learning outcome. The first one talks about explain the role of board or senior management in planning and organizing health and safety practices within the organization. Now, what I want to do here is, if we want to now wear a hat, which is to say, if you are a part of a team, which is, if you are a department manager and you're basically managing a team, what would be your role in that position to ensure that you are able to provide health and safety practices to your team within that particular department or within that organization? So, as they say, sometimes practices can only be implemented if they start from the top. So management, or the senior management, is generally seen as responsible, for some of these things or practices to be installed within the organization. So what you would generally see is that the role of board or management or senior management within the organization tends to be to help define some of these policies and practices. And these policies and practices, excuse me, these policies and practices then can be implemented down the line by operation managers, heads of department, or people who basically have the responsibility for managing that particular team. So, when I look at management or senior management within an organization, they would have the collective responsibility of ensuring that health and safety practices, or as a manual or as a system, is implemented within the organization. Are you able to hear me now? Your screen is frozen. So generally, what will happen is the senior management would be responsible for ensuring that they have devised an appropriate, strategy, and they have implemented, created at least an environment in which this particular strategy of health and safety can be implemented within the organization. And they are the ones which are responsible for setting, sometimes I would say ambitious goals and targets, which can then be, essentially implemented by operation managers or middle management within the organization, and they follow it through for the purposes of ensuring that they are the ones which oversee this implementation of the policies, so that everyone understands them, and everyone actually sings from the same, I would say, songbook in some cases. So when we look at the responsibility of the board or the senior management, what we are looking at is their role to be able to arrange effective planning, control, and monitoring of health and safety measures within a workplace. This would also include asking relevant people within the organization to look at doing a review of the preventive and protective measures which are required to be in place, and thereby ensuring that they have competent health and safety procedures which are implemented within the organization so that employees feel safe and they get these safe environment to be able to work, and you're essentially eradicating or taking out any risks by taking and implementing these protective and preventive measures within the organization. An example of that would be that, if the lift, for example, within an organization, is not working properly. Now, one of the things which the procedure or the process within the organization would be that these kind of equipments which people access to get into the premises or use for the purposes of going into their office or premises are regularly serviced across the year. Now, if they have not been serviced regularly across the year, then this could boil down to a couple of things. One, the management has not budgeted enough monies, or they have not allocated enough funds for this process to happen, once a year or twice a year, depending on the frequency of usage. In large buildings or places wherein they have number of employees and these kind of infrastructure facilities, they regularly need to be serviced and audited to ensure the safety of these equipment, and also that they are operating within the permissible safe limits within that organization. So management and maintenance of lift and lift related services within an office premises would have to be done and approved by the management. Now, that should be a fundamental thing, as far as the working within the premises is concerned. If you have a restaurant, if you have gas, electric, some of the other facilities which require regular audits, then the management should essentially provide adequate budgets and funds to be able to get proper maintenance and services of these equipments done, depending on the frequency of use, once a year, twice a year, or thrice a year in large or in very heavy usage places. So the management bears the collective responsibility of ensuring that the health and safety standards are implemented within the organization. At some stage, if it's a startup company, they would have to be formed and the management would be required to have those standards. But in some cases, they would essentially ensure that if they have been if they have been created initially at the start of the organization or the start of the company, then they are followed through and they are regularly audited and maintained, and they are functional as far as the organization is concerned. Now, the management is also responsible for providing leadership and direction. That means they would ensure that these are part of the organizational thread. That means they are discussed in annual meetings. There are budgets which are allocated for the maintenance of these equipment or services, and there is a responsibility taken in terms of ensuring that there are enough people or set of people which have been trained and they have a very clear idea and responsibility of how these standards have to be maintained within the workplace. So the main aspects of it which we would cover when we talk about the role of board or senior management would be to look at having a collective responsibility. Now, one of the examples that I would give you, when you look at the offshore disaster which happened off the coast of America, which was in Gulf of Mexico.
Hello,
You know,
hello.
hi,
I
yeah.
it
So just continuing our discussion on the first
it
assessment criteria.
it disconnected.
I know
I don't know what I missed. I'm sorry.
that's fine. That is why the session is recorded. But I was basically mentioning the first assessment criteria, which is talking about the role of board or senior management in planning and organizing health and safety practices within a workplace. So now, if you look at how do we address and understand this, is that you now assume that you are a part of management for a particular company, and when you are a part of the company in the management position. For example, if you might be a department head, you might be in the senior management. One of the things that the companies normally do when we have the management of health and safety to be done is that there is a senior enough person or an executive, which is the executive sponsor of owning this responsibility at the head office level or at the board level. That means there would be somebody who will be a chief health and safety officer if it's a large organization. In smaller organizations, it could be the health and safety manager, but there would be somebody who would essentially be in the management position, which is responsible for one, creation of these standards, ensuring that policies and practices are in place, they are up to date, they are being followed, there are regular trainings being done in the organization. If a new staff joins, they go through the health and safety training, and their aim would essentially be to ensure a collective responsibility at the top to say that these standards are there and they are meeting the requirements both from a regulatory as well as from a company standpoint point of view to ensure that people, contractors, staff, employees, whichever way you put it, are feeling safe when they work within the organization. And an example that I gave here is when I look at the point collective responsibility and leadership and direction, is that if you work within an office and the office premises have a lift, they have a restaurant, they have a gym, for example, some of the facilities which employee staff, contractors, or other people use, then in such cases the management's responsibility is to ensure that there are adequate budgets available for these services to be serviced and maintained annually. Now, depending on the frequency of usage, if there is one or two or many lift systems and there are 3,000-4,000 employees working within an organizational setup, then these services would need to be inspected, maintained, and serviced maybe 2 times, 3 times a year, depending on the frequency of use, so that they are fit for purpose. And the management responsibility is to ensure that there is budgeting available for these audits and checks and maintenance to be carried out. And that would be seen as one of the roles of the management, because they would ensure that one, it is not just on paper that these things are available, but physically and financially there are budgets available and there is an executive sponsor or somebody who looks out for this particular responsibility at the highest level. And if something is to go wrong within the organization, then that person would be held responsible because the standards have slipped, or there is a problem, or there is a mishap, or there's an accident which has happened. Now, one of the things which I would also point out, it is an example of, when management takes the responsibility. A couple of years back, and I don't know whether you recall, but a couple of years back, there was this disaster off the Gulf of Mexico, and it was called the Deepwater Horizon oil spill, and it led to the two companies which were essentially working, BP and a local contractor of BP, which essentially could not manage the particular oil platform off the coast of Gulf of Mexico, and it exploded. It led to a death of a number of workers on the platform, and then later on ensued oil spill within that region, which costed BP billions of pounds in terms of cleanup, in terms of compensation to local businesses, fisheries, and obviously the cleanup operation. Now, what is the oversight and governance point got to do with this Deepwater Horizon example? Is that at the highest level, the chief executive and chairman of BP had to resign because he had to take ultimate responsibility for that environmental disaster and the oil spill which happened, I think, in 2010, and that happened off the coast of United States in the Gulf of Mexico. And this disaster led, later on, the reports and the investigation which were carried out actually pointed out that there was systematically, let's say, faults which were not corrected by the management, and there were systematically signs which were there that this disaster would eventually happen, but the management failed to pick up and respond to these signs which were being put forward by the team which was working in the as a drilling team and the operation team which was responsible for the oil platform. And this led to finally a disaster or this particular explosion, which led to a lot of loss of life and obviously the oil spill which happened, off the Gulf of Mexico. Now, the reason I put this across as oversight and governance is that at some stage, if we do not have somebody having the executive responsibility at the top and ensuring that these safety standards are met, and there are enough compliances in place, checks in place, and which are carried out, annually to ensure that health and safety of the individuals working on that platform was ensured, that did not happen. And the report and the investigation later found out that these standards were being overlooked. They were not, brought to the notice of the management. And even if they were brought to the notice of the management did not do anything. So in such cases, you would see that when we look at organizations, it has to be at the highest level in terms of governance and in terms of ownership, that the health and safety standards have to be, owned by somebody in management. And if they are not owned, then it can lead to serious consequences. And in this case, the consequences were that the chief executive had to resign. BP ended up, filing what do you call, or paying compensation to the tune of $60 billion. And these compensations, um, which the company provided, were provided to lots of local businesses and the family of workers which lost their life. So what we do get to see is that when we do not have somebody at the highest level in terms of management, then these consequences of failure that were happening or can happen can lead to what is called serious consequences for the organization. And in this case, the serious consequence was the resignation of the chief executive and the chairman, losses which the company ensued for a number of years, and obviously losing their license to do offshore drilling in the Gulf of Mexico from the US government. So these kind of things can happen if we do not have the role of the board and the senior management not involved in planning of health and safety procedures within a workplace. Is that okay?
Yes, all good.
Sorry. So what we have to look at here is to understand in this particular assessment criteria, what is the role of the board and why is it important for the senior management or somebody at the board level to own the planning of health and safety, within the organization. That's the first part. Now, the second part that we want to look at is understanding the importance of planning as a process. Now, when do we look at the process of planning? There are changes in regulation which happen on the health and safety from the government side. And these changes typically are done because the policies, procedures need to keep up to date with the requirements of the organization and the environment and changes which are happening. A simple example that I would give you is if you have a health and safety policy within your organization, that health and safety policy or a number of other quality policies which are there, the head of the quality or the somebody who's working as a quality manager, they would normally look at reviewing those policies once in every 3 years or once, depending on again the organization and the business, once every year or once in every 3 years. One such policy which normally undergoes change, within organizations is, say, a health and safety policy. And why do we think that the changes in health and safety policy need to be done in regards to the organization? It could be because of different factors. If I think creatively, one, it could be changes in law which the government could have introduced. It could be change in the premises of the organization. So if they were in a smaller office and they moved to a bigger office, then the audit and rewriting of the policy would need to be done. For example, in the smaller office, you had one fire exit, one entrance, and one exit within the office. But in the larger office, which is maybe 2 times the size of the previous office, there are a number of entrances through which employees can come, and there are a number of exits from which the employees can also leave. So in such cases, for safety reasons, the audit of those premises needs to be done to ensure that the entry and exit points of the offices are safe. Now, in such cases, if you move to a new place, the first thing which a health and safety manager would need to be doing is drawing up a diagram or a print, creating a diagram or a footprint of what the premises look like. Is it on the ground floor, first floor? Does it have a basement? So you have a blueprint or a print being created. Then marking off the entry and exit points, security and implementation of those entry and exit points by either using CCTV cameras, ensuring maybe physical safety in terms of guard being present, and in some cases also ensuring that there are backup mechanisms in place. If one of the entrances becomes locked or does not work, then there should be an option wherein somebody at the central reception or administration should be able to unlock and lock these doors and premises to provide safety to the location and people working within that location. So just an example that I'm giving here is that why a planning process might be required and why some updates to the policies might be required because an office has moved from one location to the other, or in some cases, an organization has opened up a newer location and a newer office has been acquired. And in such cases, expansion or annexures would need to be added to a health and safety policy, or the existing policies to incorporate, let's say the provision of the second place or premises which the company has acquired. Now, it is quite important to understand that these policies and practice and plans that are in place need to be regularly updated and they need to be audited regularly to ensure they are fit for purpose. So, in such cases, when you look at monitoring them and reviewing them, you follow the process of what is called planning. Now, when we look at the process of planning, it could be short-term planning and long-term planning. Short-term planning could be that, okay, there are some small changes being done in the premises as an example. Long-term planning could be the office or the company is looking at acquiring 2 more locations or opening 2 more locational offices for its expansion plans. So in some cases, that would be seen as long-term planning or strategic planning, and that would mean that policies would have to be written or addendums to those policies would need to be created and maybe additional resources would need to be added so that the company can start planning to acquire those services or premises essentially, and that could be lease premises, buying it out on a rental basis, whatever that is. But there has to be a very clear cut plan of action which needs to be put into place, and that clear cut plan of action might be an action that the health and safety manager would need to essentially take. So when we do talk about the planning process, this would become a critical aspect of the organizational operations because this would ensure that the existing policies are evolving to meet the expansion of the company. It is following any changes in regulation which are being introduced by the government, and in some cases it is meeting the law or legal requirements for that particular premises. Now, sometimes you would get to see an organization would need to sign in a lease for 3 years, but in that lease for 3 years, if they sign in, then they would also need to agree to certain maintenance and services aspect of it, which need to be done in the premises to keep it pristine or keep it running and operational. So in such cases, in the lease agreements, you would see that if they fail to adhere to these changes or services which are required to be done, then the landlord or the premises owner can actually put it this way that they can, put legal penalties, onto the organization because they are not maintaining the premises in the condition in which they were essentially provided. And that could mean that the organization could face operational disruptions if the lift is not working, employees having to take stairs. For example, if some of the facilities within the organization break down, for example, the toilet facilities or heating in the location breaks down, then repairing of it would happen over time. But look at the operational losses or operational stress it would create for employees, because that would mean the employees would need to take stairs, or it would be if it happens during the winter months, what you would generally see is that it won't be sustainable for employees to come and work within the premises because it's too cold, or it's not having an ambient temperature for them to be able to work within the office. So in such cases, proper planning and review and maintenance needs to be done in anticipation of these problems which could be faced, and that is where the planning process becomes very important as far as occupational health and safety is concerned. Now, in order to say look at explaining what would be the planning steps or the process, I would put it this way. I would look at a certain aspect of it from a point of view of, I would say from a point of view of any such premises. So let me bring something across, which is a table that I've drawn. And that table that I've drawn essentially would give you a sense of, what that planning process, could be from a point of view of, planning for health and safety aspects of it within the organization. We do planning in any case in lots of things in our personal life as well. So if you're planning to buy a house, you're planning to move your job, or you're planning to take up a new job, you do a lot of things that you would want to do essentially to ensure that the switchover or that particular bit that you are going to do in terms of switchover going to be successful. So when we do talk about the process of planning, these are the steps that I would take normally from a point of view of planning for changes which are happening related to health and safety in a workplace within the organization. Now, as a health and safety manager, one of the things that you would do is you would look at proactive adaptation. That means you have access to plans which the organization is going to put into place. Maybe they are going to add a second premise or a working location. Then those access to those plans would allow you to start planning proactively ahead of time. You would also look at certain things like risk mitigation. Now, risk mitigation is looking at potential risks or problems that you could face when you're basically looking at expanding the remit of health and safety arrangements within an organization. Now, if there is a premise that the office is adding, just as an example, a company is adding, and in the new premise, you don't have somebody designated as a fire marshal or designated as a first aid or safety person, or somebody who has level 1 or 2 qualification of health and safety guidelines and its implementation, maybe a male and a female, because that premise has both types of gender of employees working, then it could mean that you've one failed to look at that requirement. Second, it could also legally mean that your organization could face fines. So even in an office, even if it's a small office or it's a small organization, you would still need to have these designated persons as either members of staff, which could be staff which have had and received adequate training, or dedicated members of staff who would essentially be looking at providing these services. So the first aider within an organization, if you have to have a ratio available. Just as an example, if it's an organization wherein there are 200 people working, you have a ratio of 1:20, and you would need to have at least 5 or 7 people trained as first aiders or first responders to any sort of an accident or an incident which happens within the organization. And that would mean they would be responsible because they've received adequate training, and they would be the first responders to that situation. If there's an outbreak of some sort of, say, disease which happens within the organization, as per the health and safety executive in the UK, it is a requirement that you need to log it in a logbook and also then report it to the HSC in order to ensure that this spreading of disease can be contained, or an incident which has happened is logged, and then a preventive action being taken in place to ensure that this does not happen in the future. So planning could essentially involve a lot of steps, but at the end of the day, you would go through some of these steps here to ensure that you have done a comprehensive planning with regards to maintaining and upkeeping the health and safety requirements within an organization. Sometimes you would see that budgets are not allocated, enough budgets for training is not allocated, or replacement of equipments like fire extinguishers or first aid box is not done within the organization. Not that the organization is not willing to do it, but sometimes it has been overlooked because they have not been reviewed. It is that, okay, the fire extinguisher has a lifespan of 3 years, and after 3 years it needs to be replaced or refilled. But if it has been overlooked, then it could, if there is a requirement and there's an accident which happens and they don't work, then it will boil down to the ownership in terms of ensuring that resources were not allocated, budgets were not provided, and the replacement of these equipments were not done on time, which means that if they are required for usage, would not be available, and that could lead to serious consequences for the organization. Similarly, when we talk about stakeholder communication, generally newsletters are normally sent across in the organization once a month or once a quarter or once in 6 months to keep them updated on some of these guidelines. And they could be one form of communication which is done to ensure health and safety within the organization. So when you look at planning steps, there
I
are,
have one question about
yeah,
this.
go on.
The newsletter or the communication things. So we kind of can see that whenever like you send a newsletter or email communications, like literally no one opens the emails. So what can you suggest? Such
So there are two, there are always lots of options. So two such options which I can think of is, normally what happens within organization is there are newsletters or communication which is done, which is advisory. There is information that is normally sent which is instructional, and there could be information sometimes when it is sent that you need to read it and you need to sign it that you understand it. So some part of this communication, when it is sent out as advisory or instructional, would also need a sign off from your head of department or your manager to say that please, in order to ensure that this is information critical and necessary for the working of the individual in the premises, we need a sign off on this particular information. So what you would generally see is after the newsletters are sent, there is a follow-up which is normally done to say, have you received the newsletter and have you understood the instructions and has it been signed off that you have understood these instructions? So it will depend on the kind of information being communicated. Now, to give an example and explain that with the context of an example, your question, if there is an update to a health and safety policy which has been done, and if that update is a major update, it could be sent out as a newsletter to all the employees within the organization. And there is no way that you could ensure that everybody's opened it or everybody's read it. Now, to follow it up, what you would generally see is that the organization would put that up on the notice board, would bring it to the attention of the organizations. I would say, if I look at employees, and there are a number of departments, so the department heads or the managers, and there would be a bit of a sign off required to be done in order to ensure that the changes which have been introduced have been understood by the employees. In certain organizations, you would generally see that these are sent across to the CRM system, and there is always a yes and a yes, I understand, or some sort of a sign off which has to be done, which can be done electronically now and within organizations. The other way would be to follow it up as a let's say as a measure of follow up to ensure that this has been percolated down to employees and employees understand this. There could be trainings which are organized within within the organization within different departments, and attendance of these trainings is mandatory. I'll give you an example of an organization like General Electric or GE. Now, a lot of employees who work within the organization have to do mandatory 20 trainings every year, and these trainings are then signed off by their managers or by the your concerned supervisor. And one of the trainings that is signed off by the supervisors is the health and safety training. which is a basic training which an employee attends for 2 hours, 2.5 hours. It's a workshop, and there are employees which are invited, and you have different dates across the year. They have to choose a particular date that they are happy to attend, and once they attend, they get an attendance certificate, and that attendance certificate goes into the employee file. And that is a way to basically conform to the fact that the employee understands the changes which have happened and conforms to the settings which now would be required, or the changes which are required to be followed by the employee. Is that okay?
Okay, thank you.
Yeah, it might depend on the organization and the size and scale of the business or the company, because sometimes these changes are, provided to the employees, and it's a flat organization structure, and you would generally get these changes and the understanding to these changes done quite quickly. But if it's a functional matrix or a hierarchical organization, you would normally put, if it's major changes being introduced, you would normally put, um, a follow-up process in place, or agreement process in place. If it is required for legal purposes and regulation purposes, then the buy-in or the opt-in has to happen from each employee, and there would be a process through which this has to be done. Now, the third assessment criteria that we have to look at is, we need to talk about what are the resources and skills required to plan this health and safety in a particular workplace. Now, when we do talk about, this planning of health and safety, and how do we start this process? If I'm a new person within the organization, I'm joining a new company, and one of the things that I would do is to primarily go through, when I get an employee handbook. One of the things in any organization, whether it's big, small, whichever sector the organization operates in, would be required to ensure that the employee understands the health and safety practices of the organization. Whether you work in the field, whether you work in the office, whether you work on the factory floor, or whether you work in a shared office or shared premises, you would still be required to maintain and understand the compliance required to maintain these health and safety practices within the organization as an employee. So one of the things that you would require is, when you start planning and start ensuring, just as a very basic example I would do is, if a new employee is joining, as I mentioned, there would be a checklist which the employee would be given along with the employee handbook by the HR. And that checklist would have things like, have you been issued an ID card? Have you gone through the health and safety training? Do you know where your location or place of sitting is? Do you have the resources which have been assigned to you, like a laptop, PC, whatever it is? And do you have any, say, for example, special requirements which need to be, fulfilled? For example, if the person is dyslexic, or in some cases, if the person has a weak eyesight, or in some cases, if the organization does provide additional support to employees which have certain types of disabilities, then has that been provided? The checklist could be having a number of things. I'm just giving a few examples. It could be other things as well. Now, the reason why this checklist is given is because the company wants to ensure that the employee is aware of the minimum requirements, what support the organization provides, and what are the minimum compliances that the employee would need to maintain or follow as rules and regulation to be able to work within that premises or within the organization. Now, that could start off with things like, proper resource allocation, which is to be done. Sometimes that also includes basic stationery. If you're a new employee who's joined the organization, you might need basic things like a stapler, pen, pencil, ruler, whatever it is, to be able to work, in your role. So resource allocation, just as an example that I've given, a very basic example is, resources would need to be allocated, and those resources, once they're allocated, they meet the compliance which are set as per the health and safety policy. Now, one of the things is, if the employees ask for a, say, for example, I'm just thinking, literally, is that the employee says, okay, because they work within a remote office, the remote office, they require certain things, like, because there are only 2 or 3 employees, one of the employee places a request when they join. They say, okay, can we have provision for an electric kettle? Can we have a provision for a microwave? or some sort of basic equipment to warm the food or maybe have a tea and coffee in the office. Now, procuring them, providing them, budgeting for them might be the first step. But the second step would be to ensure that they are maintained regularly within the premise and it does not lead to an electric shock or some sort of a disaster within the usage of those equipment. For example, in such cases, legal requirements would need to be met to prevent accidents and to ensure that because the equipment has been provided by the office or the company, it becomes their legal requirement that they have to ensure that the equipment is safe enough to operate, is safe, one, and then the employee also has instructions to be able to safely operate that equipment so that this is done to ensure that it prevents any accidents at the workplace, and it also ensures that the environment in which this equipment is being used or the conditions under which this is being used is safe enough both for the employee as well as for the premises, because if it short circuits or anything like that, it can lead to a fire, it can lead to other consequences, not just for the employee but for the organization. So that is where a health and safety manager would be required to look at planning these resources and ensure that the employee who's going to be using it has the skills to be able to use that equipment effectively without putting himself or others at risks. And if an accident does happen, then how is it recorded and how does it not happen in the future so that the environment or the place that they work in is safe enough for the employee and other employees working in that location. So in such cases, what would that mean or entail is that the organization would need to, one, provide different types of resources. So if you're the health and safety manager, the first thing is if you had a provision from the employee to say, can we get a new electric kettle because the previous one has become faulty? One of the first things that you would need to do is basically look at financial resources. So if there are small offices, imagine if there's a construction company and it has 10 construction sites and there is a provisioning that is required to be done in a lot of different sites, then first thing that you would do as a health and safety manager or an occupational health and safety manager would be, if there's a provision which comes to you or a request which comes to you, you would need to plan, budget, and have the resources to be able to buy that piece of equipment, or in this case an electric kettle. So for example, if 10 sites request for it, you need to have a budget for that to be provided. And then anything that you buy in terms of equipment has to have a compliance standard. It meets the standards for that particular equipment, and once it is used, it is ruggedized. Say for example, if it's a construction site, it's a remote site, the equipment that you buy, you wouldn't probably buy the cheapest one, but you'll buy something which is tested, has been tested in certain environments or similar environments, and that would mean you would need to do financial planning. Then when we look at physical resources and the equipment, you would need to have, say, for example, a fire safety blanket to be installed in those locations because it has two, three different types of equipment. And in such cases, you would need to look at facilities and equipment requirements for that location. Now, that could also mean if in a construction site there was a new equipment being introduced, then things like personal protective equipment, it could be gloves, helmets, goggles, safety harnesses, things like that would need to be provided depending on what is being discussed or provisioned for. And in such cases, you would need to look at again resource requirements, and they could be safety resource requirements, but coming under physical resources, it could be signage and tool communications. One of the things that you generally get to see in offices is that if you install a CCTV and a CCTV monitoring is being done, then most employees are required to have a sticker or some sort of a signage put on in the premises to say these premises are under CCTV monitoring, because you cannot just start monitoring employees within the organization. You need to have a policy. You need to make sure the employees are aware of the monitoring facilities, and there is a signage which is to be displayed as per legal requirements when CCTV or footage is being monitored in a particular location. And that would be examples of physical resources that you would need to look at as far as planning health and safety, or planning monitoring of a particular site is concerned. You might be a manager working remotely and you have access to 10 different sites, and you are getting footage of those 10 different sites coming through to you from CCTV because you're remotely managing it. And in such cases, you need to have a policy, you need to have the physical resources, and you need to be able to have adequate signage or communication which has been put out already before these are being put to use for the purposes of monitoring employees working within those locations. And then if I broadly look at things like skills requirement would be that the person has had adequate training on understanding these standards. For example, one could be the health and safety executive standards. What laws, policies, procedures are followed, and how are these assessed, and how they are monitored and reviewed on an annual basis. The person who's responsible for it has that knowledge and skills to be able to manage these in that workplace. Then there could be things like regulatory knowledge. The person has understanding of the laws and legislation required in that location or in that position. The person is aware of it, and they have a very good understanding of health and safety laws and also standards relevant to the industry. So I might have had a training within the construction sector, but if I've changed jobs after 3 years or 4 years and I moved to the airport or working with the airport part of the staff, then I would need another bit of training to update my skills to understand what are the regulatory requirements of working within the airport and the kind of equipment and other standards that need to be maintained. And my employer or I would need to have that training in place, and that would be seen as updating my knowledge and skills to be able to work within that environment. So in such cases, you would look at, I would say skills requirement. Then you could also look at in skills, within skills, you could look at communication skills, problem solving skills, leadership and, teamwork skills. And they would be useful because if I'm a manager or if I'm a supervisor and managing a team, then I have a very good understanding of how implementation of safety measures is to be done within that particular setup or the responsibility that I'm working. I am able to work and manage my team and individuals within the team so that we can I would say collaboratively provide the required conditions for others to be able to work and feel safe within that environment. So these are kind of, skills that I would say you would need to have. And if I put down a bit of a slide here, just a bit of a summary slide, that would be ensuring, what could be, I would say, resources and skills required for planning workplace, health and safety. So in a nutshell, if I put it this way, this particular, table would, or which I'm putting now, would essentially give me an idea in terms of how would I go about assessing the resources and the skills required to effectively maintain health and safety practices within a particular workplace. So, an example that I had taken was if I move from, say for example, a construction, job to a job at the airport, my one of the things that I would need to do is primarily ensure that I understand the updated requirement. I've had training and I understand the updated requirements of how I would need to implement the health and safety requirements within that particular role. And that would be looking at you know having the required skills and resources to be able to understand what is required and how do I adapt and how do I put them in place so that it meets the requirements for that particular role. Is that okay?
Yes, yes.
So this brings us to the end of today's discussion. Now, there are these sites that I mentioned to you that would be useful, for maybe some additional reading. So obviously, some of these are reference sites primarily for, UK and the UK health and safety standards. So one of them is ACAS, the other is BritSafe, and then I also mentioned to you site which is the health and safety executive. And what I've done here is in the plenary part, I put two, articles, one video and an article primarily for you to read for additional knowledge that will help you cover, the bits that we've discussed today. If you want to look at a bit of an example and you want to go into a bit of detail in terms of what we've discussed and see examples of that working within different, I would say, sectors. Is that okay?
Again, so for more information, I can go just to the link you.
Just to
Yeah,
these links that I've provided here, yes.
yeah. Okay,
Okay.
okay.
And if
Uh,
you have any queries, you can send me an email at Learnerwork, and that would allow me to, send you details on email as well.
okay, okay. And regarding the resources that you have provided in the Moodle,
Hmm.
do you uh, think I should read them right now, or you think I should go through each learning objective and just like cross out this complies to this one on this, or what do you think?
See, there are two ways I can mention this to you. One would be that if you read them beforehand, before we have the sessions, they are going to be useful for you because you'll have questions that you can ask, and you would have essentially done some bit of additional reading prior to the session that we are holding. And the other is sometimes I do see that it is important to essentially, let's put it this way, go through this with the tutor because you get a perspective of what is required to be studied. So you can take both the approaches, but I personally would say that if you go through the presentations before the session, it might be useful because it will allow you to interact more and ask more questions or queries
Mhm.
during the discussions that we are having. Because some of the presentations are going to be more detailed. And what I would like to do is um, today was the first session, so it's gone, on for about an hour and a half. But generally speaking, I would like the sessions to, I normally conduct sessions which would normally be about 35 to 45 minutes. And they would be useful for you to understand the topic and the concepts and the important theoretical frameworks, but also if you've read through those presentations prior to the session, they will also allow you to ask queries and questions which we can discuss, after or during the presentation and the discussion that we are doing on the learning outcome. And that would be ideal for you because that would allow you to, not just understand the concept, but also understand it from a point of view of any doubts or queries that you have.
Okay, okay, okay. Yeah, makes sense.
Okay, no worries.
So also, you also advise me to finish like the lectures of all the learning outcomes, then start with the assignment, right?
That's correct. So
Hello?
sometimes what will happen is that if you're looking at reading ahead and going through the course on a faster pace, then what I do see is that sometimes learners will go through the presentation themselves, and what they will then do is basically start attempting the assignment as well.
Okay,
But
okay.
if you study the course with us, like I'm doing through the lectures, that means you're studying one learning outcome with us per session. You're probably looking at completing this course in about 26 weeks, which is about 6 months. But if you're looking at completing it earlier, then once you become comfortable with the session and the pace at which we are teaching, after the first unit, we can have multiple sessions being done, for you so that you are able to follow the course and obviously cover it quicker.
Okay, okay.
So the
I think,
totally flexible approach.
yeah. Okay. I suggest, like, for me, to read the materials that you have provided, like,
Yes.
not so much in depth, honestly, like just to have an overview, then go through the presentations with you. Then after that, maybe I can start with the assignment and see how it goes. Once I finalized it, maybe I can start with you with the second unit. What do you think?
Yes, that is absolutely okay.
Okay, let's see how it goes then.
That's fine, no worries. And what I will do is just after the session, as I mentioned earlier, I will update. You'll see a copy of the recording here. and you would also see an updated presentation, because the one that I have on the Moodle would be replaced by the updated one, because I've added a few things to the slides, and obviously, they would be useful for you to access and start studying. The updates normally happen as we do the live sessions. It won't be possible for the updates to happen, offline, because every tutor is different. They will pick up the stack of slides, but they will also add to them, like I always do. So sometimes you would see that the new slides would come up and they would replace the older version of the slide on the Moodle.
Okay, no worries, no worries.
Okay.
And you'll be providing the material for all the units, or someone different?
No, we will be providing the material for all the units. I might not do it personally because I don't teach all the units, but the units I teach, I will provide. And if there is another lecturer who's teaching that unit, they will go through the same stack of presentation and slides which are available, but they will update it, like I've just done the update right now for LO1 2025.
Okay, that's
So
great.
it will happen periodically, but it will happen as you're going through the units with the particular person or with the particular lecturer.
Okay, that's great. Seems good. Let's see how it goes. Okay.
Good stuff. Thanks, Ali. Thanks for joining today,
Okay.
and I'll see you on Tuesday.
Thank you. Again, your name is hard. Sorry.
Raman.
Raman. Okay, Raman. Thank you so much.